Hello, hi everyone. My name is Dr. Sana Khan. I welcome you all to our app that is InstaPreps. So I hope you all are watching my videos. You are studying very hard for your board exams. So in this video, we are going to cover about the clinical features of cancer and treatment of cancer. The remaining part is already covered in the previous two videos. So please do watch all the videos. Okay, so let us talk about the clinical features of cancer. See, the clinical features of cancer is actually depend on the location of tumor, right? In the initial section, we talked about the tumor can grow anywhere in the body. So wherever it is growing, it is going to produce the symptoms at the place where it is going to produce, right? Where it is growing, right? So it's the clinical feature depends on the location of tumor, on the size of the tumor, at which stage the tumor is, whether it is showing metastasis or whether it is confined to a particular area. So these are the three conditions on which the symptoms and signs of cancer depends. So some cancers, there are certain cancers which can be felt through the skin. See, this is a skin which is very smooth, but sometimes, there is a lump-like formation like this. Okay, and when you just feel it, you can feel that lump. So there are certain cancers which you can even see and recognize. Like one of the common sign is, lump, developing lump on the breast or testicle. Or melanoma is also a cancer which can be felt through, because I have told you already, if there is any sudden color change, okay, if there is any sudden color change in a wart or a mole, then that could be one of the alarming sign of cancer. Apart from that, the oral cancer may show white spot patches, like in your tongue, okay, in your tongue like this. Yeah, it may show white spots on tongue or white patches in the mouth. So there are certain cancers which you can recognize by certain signs like lump, then the changes which takes place in the water mole, or white spots on the tongue. Apart from that, there are certain common symptoms of cancer. Okay, there are certain common symptoms of cancer. If a person is having more than more than 6-7 symptoms among these common symptoms, then the person is more likely to develop cancer. The first thing would be the nagging cough or hoarseness, thickening or lump in any part of the body, changes in bowel habits, a sore that does not heal. Sorry. Changes in wart or mole. So nagging cough, thickening or lump, changes in the bowel habit, sore that does not heal, changes in wart or mole. Apart from that, indigestion, difficulty in swallowing, unexplained change in weight, unexpected loss of appetite, unusual non-injury bleeding, and discharge. See, these are very common symptoms which I think by reading only you can understand. So if a person is having more than 6-7 symptoms, then there is a chance that the person is having, there is a chance of person getting cancer. Okay. So now what happens? Now these are the certain features. These are the certain clinical features which a person shows when he tends to develop cancer. But when the cancer spreads, okay, when the cancer spread, when it shows metastasis to different parts of the body, so now there would be certain additional symptoms which will come up depending upon the area which has got infected. Okay, because we know that cancerous cells form their own blood vessels through which the cells can go through the brain, it can go to the liver, lung, lymph nodes, it can go anywhere in the body, and wherever it reaches, it will create a problem and it will produce the symptom accordingly. So if it goes to the lymph nodes, so the lymph nodes of ear or any part of the body would get swollen, but yeah, this is very early sign of cancer. If it goes to the brain, then the person may suffer from symptoms like headache, vertigo, seizures. These are the symptoms a person may suffer from: a headache, vertigo, and seizure. If it goes to the lung, then the person may have a difficulty in breathing, shortness of breath, coughing, of blood coming out from the mouth, hemoptysis, that is called as hemoptysis. If it goes to the liver, the person may suffer from jaundice, okay, hepatomegaly, that is enlarged liver. This could be the certain symptoms of cancer in the liver. Then if it goes to the bone, the bones may become brittle, weak, and the bones may be painful as well. So it depends. So the clinical features actually depend upon the part which gets affected by the cancer. So you have to just talk about the common symptoms which a person may have if he develops the cancer, And you have to talk about the metastasis symptoms. So if the cancer spread to different parts, what kind of a symptom they are going to produce. Now coming to this part where I have seen a lot of children don't pay attention over here because they feel like, treatment is something which we are going to study in MBBS and all those stuff. But yes, it has come, it has come in your NEET exam. So please go through this also. So see, anyways, if it is any of the disease, you already know that early detection of any disease is very, very important so that it doesn't harm to the body to that extent. So early detection is the most important thing. There are certain tests like bone marrow biopsy, tissue biopsy, where the samples of bone marrow or tissues are taken and they are tested whether they have undergone a cancerous changes or not. There could be abnormal WBC count. Then PAP test, which is done for cervical cancer, where they take the lining of take the certain cells of the cervix to understand the mechanism of their cells, to understand whether they have undergone any changes. Apart from that, there is more better technique nowadays come up, that is CT scan, which is also called as computed tomography, MRI, which is called as magnetic resonance imaging, which are useful in detecting the internal body organs cancer. Apart from that, there is a radiography, which is also useful to identify whether there is a bone cancer or not. So cancer specific antibodies can be tagged with a detector, that is use of molecular biology, that is microassay and PCR test to detect the expression status of cancer associated susceptible gene, because whenever your gene gets converted from proto-oncogene to oncogene, it will show certain expression which can be detected by the PCR test. So treatment obviously will depend on the type of the cancer and the stages of cancer as well. Okay, so it will depend apart from the type, stages, it will also depend upon the age of the patient, how healthy the patient is, okay, and personal other characteristics as well. So treatment usually fall into following categories like surgery. Surgery is one of the treatment which we adopt for specifically benign tumor, because it's not spread, it's enclosed in a capsule, so it's easier to remove it through the surgery. Then apart from that, we can go for radiation. Okay, so radiation could be one of the treatment where we use high energy X-rays to destroy cancerous cell without harming normal cells, where we use certain elements like iodine, radon, cobalt, etc. Then gamma knife is also a type of radiosurgery for destroying brain tumors. So this is specifically used for brain tumor where it's, the rays are pointing towards the tumor. You can clearly see in the diagram how this gamma rays is targeting the tumor like this. Okay. So gamma knife is again one of the treatment for cancer. Apart from that, chemotherapy, that is use of chemicals or medicines, can also be used as a treatment of cancer. Then coming to the next part, that is alpha interferon. This was, I think, this came up in one of the exams. Usually students forget to read about this. Alpha interferons are also given because in case of cancer, because this activates patient's immune system and destroy the tumor cells. So you have to remember that alpha interferons can also be given. Then immunotherapy is also is a kind of a therapy which can be given in cancer patient. Then hormone therapy and gene therapy can also be used for treatment. What is gene therapy? What is hormone therapy? That all we will be talking, like PCR, you'll be studying about that topics in biotechnology chapter. Okay, so I'll be soon uploading the other chapters of your term 2 also. So please stay tuned with our app, that is InstaPrep, and do watch it. So initially we talked about the diagnosis, how could you diagnose a cancer, and then we talked about the treatment of cancer. So there is no single treatment for cancer patient. We have to go with combination therapies and certain palliative therapies, which is very much needed for the cancer patient. And cancer patient has, because of these therapies, because of these chemotherapies, they suffer from a lot of side effects, specifically major of the drugs which are involved to treat cancer causes hair loss, anemia, and many other symptoms like heat flush, irritation, and lot many things. Okay, so that's all about the treatment of cancer. So we talked about the clinical features, where we talked about that clinical features totally depend upon the size of the tumor and it depends upon the area which is affected. Okay, so there could be certain symptoms which could be seen in the cancer patient, and other symptoms could be the metastasis symptoms, which is due to the spreading of cancer to other parts of the body. Then we talked about the diagnosis for like biopsies and PCR and all those stuff, which through which we can diagnose whether a person is having a cancer or not. And after that, we talked about the treatments. We talked about surgeries, immunotherapy, gamma knife, alpha interferons, which is used for treating cancer patients. And then lastly, I told you about certain side effects which a cancer patient can have due to these heavy therapies. Okay, so here we complete the entire video on cancer. There are consecutively 3 videos which are there on cancer. So do watch it, do make your notes and study, because it's a very, very important question for your board exams. Okay, so I'll meet you soon with the next video. Till then, bye, take care, work hard, study for your dreams. Bye.